to Mr. Masiyiwa for his part of the question.
I'll pivot straight from what John is saying. We met with President Macron and the African Union leaders, the Bureau of Presidents, the 10 leaders. And President Macron represented the donors who finance COVAX. They finance COVAX. The vaccines purchased by COVAX are supposed to be their money. So how do we get to a situation where they give money to COVAX, who go to India to purchase vaccines, and then they tell us that those vaccines are not valid? I'm not going to debate that point. It's self-evident where the problem is. But it's not the only problem we have with the EU. And let me address the EU. The fact of the matter is the EU has vaccine factories. It has vaccine production centers across Europe. Not a single dose, not one vial has left a European factory for Africa. Okay? When we've gone to talk to their manufacturers, they tell us that they are completely maxed out, meeting the needs of Europe. We are referred to India, okay, where a number of manufacturers exist that are manufacturing vaccines like the AstraZeneca vaccine under license. Okay, so Europe has to decide. You can't say you support us. They have vaccinated so many of their own people that they can now watch football without masks. Okay, our people have not been vaccinated. Less than 1% of our population has been vaccinated. That is just the facts. Okay, they don't need me to interpret them. Okay, now is the time for Europe to open up its production facilities so that we can buy vaccines. We are not asking for donations. We have money to buy vaccines. Vaccines are not expensive. Certainly not when it comes to the lives of our people. The poorest of the poor African countries have all stepped forward and paid deposits for us to buy vaccines. Okay? But we need those European factories. In the Netherlands, all those, Belgium, Italy, they must open them up and sell vaccines. We didn't ask anyone for a donation. So these are the facts.
Thank you very much. We have a question that's coming from David Wafula of the BBC Africa, but that question has already been taken up by Dr. John, and it was on the issue of the Green Pass. So we move straight on to a question from MacDonald Zirutwe, and MacDonald is with Reuters. And he is addressing his question to Mr. Masiyiwa, and he says, could you give us the latest? How many African countries have actually confirmed their orders and paid their deposits to Afreximbank for the J&J doses that AVAT secured? And why have countries been slow to confirm their orders and pay their deposits for the J&J doses, which were secured in March, and for which African Union has worked so hard? So that's the question from MacDonald Zirutwe of Reuters.
MacDonald, I don't know where you get this idea that they have been slow. No one has been slow. For purchases, the process that we concluded the contract at the end of March. Countries have to apply. We've given them the opportunity to apply for their doses. We've given them the opportunity to go and get approvals that they need. They have to review the contracts. Each country must sign on to the contracts, the indemnities that are associated with these products. We are perfectly happy with the process. Remember, every country knows the shipment date to be August. Last week, we met with all the finance ministers, all the health ministers, with the World Bank. We have a meeting this afternoon. The processes are going as well as I expected, if not better. So I'm not an unhappy camper about the process, okay? And we have a team ready all the time to answer and to deal with problems. A lot of the countries didn't have the money, which meant they first had to apply to the World Bank for a loan, get the World Bank to process the loan, and then come back to us. The World Bank, as you know, have announced that they have now received requests for loans from 41 countries. And they have promised us that they would process all those loans before the end of June. And that's partly why we're meeting today. So it's well on track.
All right. Thank you very much for that assurance. Colleagues, we have a lot of questions that are coming in, and we have to go through them in the next 20 or so minutes. So I'm going to be asking my colleagues from the media to please just pose the one priority question that you have. And if we have extra time at the end of it, we will then come back for second follow-up questions. So with that, let's move straight on and back online. And we say good morning to Paul Adepoju. Paul, please go ahead with your one question.
Yeah, thank you very much for taking my question. So I'd like to ask Mr. Strive what the plan for COVID Shield is, considering they've not been able to meet up with the arrangement. So is EVAT completely phasing out the vaccine? And what do you think the guidance for individual persons, Africans that have already received these vaccines and are planning to travel to Europe? So what is the guidance for them should be?
Just by way of clarity, Covishield is the AstraZeneca vaccine produced by the Serum Institute. We met with the Serum Institute in November and December and January as AVAT, and we took the decision not to buy from them. We feel totally vindicated by our decision that they would not be able to deliver. We understand COVAX has an order with them of more than 500 million doses. We have also heard that several countries have made direct purchases from them. None of those have been delivered. The excuse given is that the Indian government has banned exports. When we met with them in February, it was pretty clear that they were not going to be able to ship. And that's why we went back to the member states and we said, despite the very favorable price of this particular vaccine, we would not add it to our own portfolio. So I cannot comment beyond that. The rest has to come from COVAX as to when they might expect more doses to come through, or if ever they'll get doses. I think at some point they will come through. But where we stand right now, I cannot speak for Covishield.
Thank you very much. Let me take a question that has come through on our WhatsApp platform, and it's coming from Gabriel Baglo. And Gabriel is a senior advisor with the Congress of African Journalists. And his question is to Dr. John. He says, my question is on the second jab. Is it appropriate to take another vaccine that is different from the first jab that is no longer available? So for instance, if one took AstraZeneca, can one take J&J or another for the second jab? That's for Dr. John.
No, thank you. That is a question that has been coming up a lot. And the short answer to that is yes, you can do that. The studies are now beginning to show that if you take that, I mean, it also, the vaccines boost your immune system just as if you were taking the similar, the identical dose. So if you took AstraZeneca vaccine today, and you take as either Pfizer or Johnson and Johnson, it really produces a very strong reaction, a positive immunological reaction. So yes, you can definitely do that. But ideally would be to stick with the same vaccine, as that was how it was tested in clinical trials before issuing that efficacy that you all heard when the vaccines were being produced, and we were told that the efficacy is either 90% or 95% or 60%. So I think, but with the shortage and the challenges that Strive just mentioned with access to vaccines, studies now conducted in laboratories have shown that laboratories and in clinical trials have shown that you can do that as well. So I think we have always said that for the AstraZeneca situation on the continent, because of the shortage, that once you get the Johnson & Johnson vaccines that you heard as Strive mentioned, that will be arriving beginning the first week of August. Those who have received their AstraZeneca doses and are in short supply of the second dose can always get the second dose, the Johnson & Johnson single shot.
Thank you very much, John. Yes, Mr.
I can even say, John, the good news is that the first shipments of Johnson & Johnson vaccines is next week. But we will be shipping the vaccines jointly with COVAX as donated by the United States government.
Yes.
And they are going to all member states. Obviously, if you're a healthcare worker and you have had only one AstraZeneca vaccine dose at some point earlier, and you've been waiting for your second one, speaking with my diploma given to me by Dr. John, and so much time with, I urge you to take that Johnson & Johnson vaccine as your second dose and move on.
Thank you very much. We go back to questions coming online, and welcome Sophie Mukwena of the South African Broadcasting Corporation. Sophie, please just tell us who your question is directed at, and then go ahead.
I'm sorry to disappoint you. I need to ask questions. One from Dr. Nkengasong. Dr. Nkengasong, the issue of the Beta variant on the continent, the challenge in terms of efficacy of vaccines, have you finally come up with a clear answer what member states must do? And then to Dade Strive Masiyiwa. And Dade Masiyiwa, you were very critical on COVAX facility. And do you think the COVAX facility, we can put a blame on them for the delay in access to vaccines on the continent and how they've administered this whole facility?
All right, let's start with Dr. John.
No, thank you. I think, Sophie, so let me address your question this way. One, we know for sure that the current vaccines that we have are working well against the Delta variant. So the Delta variant transmits about 40% more than the usual variants. Of course, it means it causes death and overwhelm your health system. But in terms of vaccines efficacy, we have no evidence so far that the vaccines that we are using, be it the Pfizer, the Johnson & Johnson, and others, are less efficacious against that particular variant. We had very clearly the B135 variant from South Africa was problematic against the use of the AstraZeneca vaccine. So far, that is that is the science we know. And that's why we are very confident and really are in urgent need to move the Johnson & Johnson vaccine. That particular vaccine has also been studied across different variants, and it tends to hold its own in terms of producing neutralizing antibodies at sufficient levels. All the vaccines that we have out there, if you challenge them with the B135 variant, They reduce the neutralizing antibody level, but not significantly. That would not give you enough protection. The only vaccine that knocks it down that very significantly, that is from this variant, is the AstraZeneca vaccine there. So that is what we know, that is what science is telling us. What does this mean in terms of the continental approach? It means that we need to analyze the variants more frequently to see the shift. I mean, as one of the colleagues, I think Gabriela from the Wall Street Journal asked, what is the main variant driving the third wave in Zambia? We know for sure that the B61 variant, that is the Delta variant, is in Zambia, but we don't know the proportion. Okay, that is what should be of interest, or not just whether you detect a variant, but what is the proportion of this variant compared to other variants there? And they tend to evolve very quickly. If you look at DRC in March, the first Delta variant was identified in DRC in March. And as of today, it has become the predominant variant in DRC. So I can affirm and speak with certainty that that is the variant driving the pandemic in DRC. But we still have to see the data in Zambia. And again, we have no evidence that the Johnson & Johnson, the Pfizer, the Moderna, or even the AstraZeneca vaccine are less efficacious against the Delta variant. That's all I can say with respect to what science is telling us.
Thank you. Over to Mr. Masiyiwa.
Yes, thank you very much. Yes, I have been extremely critical of the COVAX facility for some very simple reasons. In our capacity as AVAT, John and I are responsible for coordinating and monitoring the supply of vaccines. And we met with COVAX, and we meet with COVAX almost on a weekly basis. And we met them back in January. And what we were keen to establish was, what were their shipments? We wanted to know exactly, what have you bought? Which vaccines are they? When will they arrive? Because it's our duty to the member states. We are the ones who report to the member states so that the member states could plan. We were given a schedule in writing that we would receive vaccines from the end of February, going through to December. We went back to tell that to the member states. We shared that data to the member states. We were not given material information, such as actually they didn't have the money. They were still trying to get money, that pledges which had been made by certain donors had not been met. That's pretty material information, which had we known that actually this was hope and not yet reality, we may have acted very differently. So our own planning was that we were supplementing what they were doing. Because after all, the donors had met as far back as June 2020 and said that they were going to give COVAX $8.2 billion. So many countries were just sitting back saying, the vaccines are coming. We found ourselves in March scrambling. Okay, now we're told that it's India's problem. We think the problems are much deeper than that. Okay, and certainly, if you have a problem, you must treat others with the respect to be able to go back and to say, listen, this was our best endeavors. We're not able to do anything. See what you can do for yourselves. We, as Africans, are disappointed. Okay, and I will say that again and again, because it's a long way from 700 million doses to 30, 40 million doses. Okay, so let's be clear with each other. Where we are right now, the situation may have been very different had we known back in December that, listen, this help is not coming. Do what you can for yourselves. But that's not the place where we were put. And it's sad that we should be in that situation.
All right. Thank you very much. Let's go back to our WhatsApp platform and take a question from Judith Akolo, who is with the Kenya Broadcasting Corporation. And she says, my question is to Dr. John, and it is Africa headed to seeing COVID-19 become endemic on the continent? And what would be the worst case scenario if COVID-19 does become endemic in Africa?
I think, Judith, we first of all, let's remain optimistic that the efforts that people like Strive, Professor Benedict Orama, Dr. Vera Songwe, and others are doing, working every night and from 9 p.m. to 11 p.m. and to acquire these vaccines would yield fruits that we, in the next 12 months or so, we vaccinate at speed and at scale. If we do that, and the population cooperate, and I did share some information with you today on how much countries are using their vaccines, which is a very good indicator of that. If we have a predictable supply of vaccines, the vaccines will be used, then we can defeat this pandemic. We can break the backbone of this pandemic by the end of next year. But if we do not do that, if the vaccines are not available to enable us vaccinate at speed and at scale, then of course, the unfortunate answer is that past next year, we will be moving towards endemicity of this virus on our continent. And the consequences will be catastrophic. We don't want to see that. Director General of the Africa CDC, Dr. John Nkengasong there.